Bismillahirrahmanirrahim. Notes are very good for assessment and for making a good plan for your patient. SOAP means S means subjective, O means objective, and A means assessment, and P means plans. Uh, Subjective. First of all, we come towards the subjective part of the assessment. Subjective, as the subject name suggests, that what the patient will say to you. If the patient is unable to say, he is not conscious or he has some problem, then the attendant of the patient, his relative, his son, his daughter, his wife, his husband, her husband, father, etc., they will tell about the patient history. Whenever we take history from the patient, the first question, which is important, not necessarily you can have your order changed, but the first question which is important is complaint of CO. So complaint of means that what complaint and what problem the patient have brought forth, what he is suffering from. For example, a patient comes to you and you ask, what is your complaint, what problem you have. He or she may tell that he is having pain in his shoulder, and the shoulder has got stiff, he can't move his shoulder, and he can't reach his side pocket, can't make ablution, and etc, etc. So that is the complaint of the patient. Pain and related problem, that is a stiffness or other weakness and handiness and the activities of daily life. So first of all, you have to write down the basic or the main complaint of the patient. Then history is important, because you have to ask the patient that when it started. This is a very important question. Some patient may come and tell you that they had 10 days back they had this problem, or some may say that 2 or 3 months have gone, or some may say some years have passed. So writing that part of the subjective is very important, that when it started and what happened initially, how you developed this problem. For example, some may have had a road traffic accident, some may have fallen from stairs, some patients may have got a hit over his shoulder, head, or any part of his body, and after that he would have developed that problem. So you have to ask the patient the history which he is bringing forth, when it occurred and how it occurred. These two are very important questions: when and how. Also, you can say where it happened. So he may say it happened upon the road, it happened in his room, it happened in the ground, it happened at a class, in his office, and somewhere the problem may have occurred. So in history, when, where, why, and how, all these such things happen, they are very important, and they should be asked and be written in a very proper and clear way. In history, you may also ask the medicine the patient take, or if he or she has had the medical treatment or the physiotherapy treatment for which he has come this time. He may have had it many times before this. He may have gone 2 times, 3 times, etc. for that purpose. And you also have to ask, have you had any treatment for this? Which type of medicine you are taking for this? Coming to the diagnosis part of this topic, that what is the diagnosis, main diagnosis. The diagnosis may have been written in the medical notes of the patient, or it will be apparent from his history, that some problem the patient is having. He is having a cervical spondylosis, he is having a frozen shoulder. So you have to write down that proper diagnosis once upon your book. This is not a lengthy process, it's a very short process, but you have to follow all the steps. If the steps are being left, then your assessment will be not enough, and you will have some problem in making the plan, or it will be not enough. Other things which are important, that you have to ask about the aggravating factors and the relieving factors of the patient. What aggravates your pain? Especially they are important in low back patients, that you ask aggravating factors, relieving factors. Some patients get intense pain in sitting, some get intense pain in lying during sleep. Some people get relieved their symptoms with medicine, some with rest, some with walk. So if a physical therapist has to ask these aggravating factors and relieving factors about from his patient. The other thing toward in the subjective part of the assessment towards we have to proceed is the pain rating. You have to rate the pain of the patient. For pain rating, we have a scale called the visual analog scale. Visual analog scale, as it has been plotted here. This is from a scale from 0 to 10. So 0 is no pain, and from 0 to 5 this is mild pain, and 5 is moderate, 4, 5, 6 is moderate pain, and 5 above 6 it's become severe, 7, 8, 9, and at 10 it becomes worse pain. It's worst pain. It is also called as excruciating pain. So the patient may say that he is having a pain of 70% uh, of the scale, or he may mark some point upon this scale. The physiotherapist will ask, they ask that if you measure your pain, how many pain you have. After explaining him to the concept of no pain, mild pain, moderate pain, and severe and worst pain, he may mark, and patient marks, I'm having an experience at some point that they have 60% pain, they have 70% pain, they have 80% pain, or some may say that they have 10-degree pain. So after that you have to write that which one in the log scale down, and as I have written here, the 7 by 10. Other things we have to ask from our patient is they are the comorbidities. Comorbidities mean that is your patient having some of the common diseases like diabetes mellitus, hypertension, ischemic heart disease, asthma, hepatitis C, B, etc. If he, she, or any other chest complication. So, if these are to be asked to, and they may have a role in the further proceeding for the treatment plan of the patient, or the patient is having a hypertensive patient, and he's apparently seems to be in a hypertension. So, before proceeding for any heat modality or any congested place, so he may get very dangerous symptoms, and it is important that to note that if the pure patient is hypertensive or not. Patients with diabetes mellitus may have sensitivity problem, and their sensation may be weak, and if some heat or cold modalities are applied to the patient, they may be having problem in sensation, and impaired sensation may cause burn to the skin, which is a very serious problem, and it comes under the negligence of physical therapist. After that, the physiotherapist also has to ask the patient about his home situation, and home situation asking is very important for elderly patients and for patients having stroke or spinal cord injuries or head injuries patient, because if they are managed at home, and the physiotherapist advise the patient some plan for treatment, some types of exercises, some types of supporting devices. So he may ask the patient that where you live, are you living in a flat or at home, are there any stairs in climbing or coming down from your home. So the home situation is to be asked to, and it has to be written in a very proper way. So these are some of the important, some not all, but some of the important parts of the subjective assessment of the patient. And further section, inshallah, I will discuss about the objective and then assessment, and enter the plan section of this lecture. So I think this will be, after hearing this, you will many of the students and many of the physical therapists may find it beneficial. And if you find it beneficial and supportive for your practice, please do comment, and also support us in our channel, and subscribe it and like our video. Thank you so much.